Hi everyone and welcome to today's webinar. My name is Miriam Holden and I will be your host today. So a warm welcome to all of our healthcare professionals, all the attendees here today and organisations joining from Ireland and across the globe. So if you have we're just going to pop on and go through some of the housekeeping rules. So your microphones for this webinar will be muted throughout the whole webinar. And if you have any questions throughout the webinar, pop them into the chat box here and we'll be able to answer them in the final Q&A session. So you can pop them in the chat all the way through. And if you have any questions to start off with, just pop them in the chat, but we will get back to them at the end. So don't worry. If you've missed the webinar or if you have to pop off or anything like that, don't worry. A recording of the webinar will be sent out to you tomorrow morning. And if there's any kind of resources or anything I need to add to the emails and stuff, we can send them out with that webinar recording email tomorrow. And then if you have any questions afterwards, just respond to any of the emails that we've sent you and we'll be able to get back to them. So just a little bit about what you may have seen our previous webinar, and we just give you a little bit of background about RCSI and what we're getting up to at the moment. So RCSI is a prestigious university based in Ireland with a profound global impact. Our commitment to fostering good health and well-being has earned us the esteemed title of World #1 in 2023. Furthermore, we are consistently ranked in the top 2% of the World University rankings for 2022. And in recognition of our dedication to student engagement, we've also been honoured as the Student Times University of the Year in 2022 for this category. So at RCSI, we take immense pride in our rich heritage and long-standing legacy as pioneers in healthcare education. With over 230 years of experience, we've been at the forefront of shaping the future of healthcare leaders. Our commitment to excellence has enabled us to maintain our position as leaders in this field, and together the Centre for Positive Health Sciences and RCSI are poised to make significant contributions to the advancement of healthcare and well-being. So we look forward to the transformative journey ahead, driven by our passion, expertise and commitment to positively impacting society today. So that gives you a little bit about our background and what we have achieved so far. So just a little bit about RCSI. We are committed to our vision of leading the world to better health and empowering healthcare professionals to elevate their careers and, most importantly, deliver better patient outcomes. And you'll see from our mission is supported by the 3 institutional pillars. We're passionate about delivering engaging learning experiences to healthcare professionals, leading transformational research and supporting societal well-being in Ireland and across the globe. So our programs are suitable for all of those working in the healthcare sectors, and then additionally including professionals, managers, entrepreneurs, and administrators who wish to develop their leadership and management capabilities. We currently offer programs at master's, postgraduate diploma, PhD and professional doctorate level. So if you want any information about the following courses, please let us know and our team will be able to link in with you and answer any of your questions. We also have a dedicated program information webinars where you'll get lots of specific information on these different courses, like the one that you're attending today. So if you're looking for information on those, just please let us know. It should be noted that there is a progression from the professional diploma to the master's. We get a lot of questions from this. So you will be eligible to progress onto the master's, and you'll be exempt from modules 1 and 3. There's 3 modules in the professional diploma carried out over 9 months. So you'll be exempt from 2 of these 3 modules. The lifestyle medicine module, module 2 in the professional diploma, it's like an extension when you go on to the master's, so it's a step up again from what you learned in the professional diploma, so that's why it's not exempt. So there is a reduction of fees as well for students progressing, and the professional dip is not the first year of the master's. It's a 3 10-credit modules carried out over 9 months compared to the 6 modules in the year 1 of the master's. So in the professional diploma, you have a little bit more time to do all the 3 modules compared to doing 6 modules in the master's for the year one of the Masters. So we'll go into more detail on all the professional diploma with Dr. Trudy Mean, but that gives you a brief overview of like progression from the professional diploma to the Masters. And if you have additional questions on any of those, please let us know and we'll explain further. But that, like, if you have any questions, we'll be able to answer them at the end. So the Centre's programmes provide an enhanced student experience throughout the combination of online learning content and interactive webinars. These offerings foster collaboration and support while providing immersive development opportunities for current and aspiring leaders. What sets our programmes apart is the exceptional expertise from our academic team. So our academics are not only contributing to cutting edge research in the field, but also curate industry experts to deliver high quality content on our programs. So this unique combination ensures that our participants receive the most up-to-date knowledge and practical insights from both academic industry perspectives. So that's a really nice thing to add to our courses. And at our CSI, we make sure that the right support is there for whenever you need it. And we want all of our students to engage in the course fully. So like, especially with online courses, there's always the fear of like the networking element or the one-to-one face-to-face kind of contact will be lost. But during your time with us, you'll have access to a number of different academic resources to support your learning. So you will have a 2-week online orientation to get yourself familiar with the people you'll be involved with, the team, the platforms, and how to use the virtual learning environment. And then you'll have access to our online library, so you'll be able to come and use that, no problem. Reference guides, EndNote, academic writing supports, assessment feedback, group writing supports, recommended reading lists, and assessment guidance, to name just a few. But for now, I'm pleased to introduce Dr. Trudy Mean. So Trudy, if you'll just pop on your mic there. Trudy's going to give us a little bit of insight about who she is, what she does, and I suppose her role as the Programme Director on the course. So handing over to you now, Trudy.
Thanks very much, Mariam, and welcome everybody who's joining us today. It's lovely to get to talk to you, and hopefully you have some questions, and don't be shy to ask questions. This is the time to ask. I'll give you briefly a little bit about me, and the main thing really to say is that my role as the Centre Director is just to hold the academic integrity of the programme, and to make sure that the people we invite to lecture and work with you are of a really high standard, and that the content you get throughout your programme is of a high standard. And so it's not really about me in terms of my background, but just to give you a sense of who I am, I've a dual qualification in that I've an academic background as a researcher, so I have a PhD, but that's in social psychology. So I'm interested, as in the health field, in the social determinants of health, what happens in our context and our environment, issues of inequality, and all of those things, and how they influence in health. But then previous to getting the academic side of things, I've qualified and worked as a clinical psychologist within the HSE here in Ireland. So I have the traditional kind of deficit model of mental health and all of those things. And I guess a lot of experience of working within the HSE. I've worked in James's in Dublin and in St. Vincent's. And I've worked in James's and Vincent's, I've worked in adult and older age psychiatry and mental health. And then in Wexford, I've worked in CAMHS, which is child and adolescent mental health. But I guess for anybody who's here from the health service, the relevance of me being part of the programme is that I guess I understand the realities of the health service and the challenges within that, which I think is helpful for you all. And partly because of the challenges in the health service, I left Ireland in 2010 and went to work in South Africa for 7 years, where I worked for Stanford University on their community engaged learning programme, and they would send students from the States over to Cape Town and stuff like that. So that's me. I think the last thing to say about me is that I'm one of a team of really interesting professionals who have a variety of backgrounds. And that's one of the great things about the programme. It's the chance to work with people from a diverse range of professional backgrounds. And I think that's the key, because also within the student group, you get a diverse range of people that you get to work with within your own group. So just to kind of flag that, but I'll come back around to some of the other people on the programme just now. Okay, Miriam, I think we can go to the next slide. Okay, so I just want to give you a little bit of an overview, but not kind of overburden you with too much information, but just to give you a sense of how the programme works. The nice thing about it is that it's in 3 modules, which essentially means that you can break those 9 months down into 3-month chunks, okay? And at the end of every module, you have a written assignment. And so you know what's coming. You have the assignment due date when you start the module, and you have those 3 months to work towards your assignment. Obviously, a lot of people leave it until the last minute, but there is the opportunity to kind of timetable and scaffold and keep an eye out. And there's no kind of surprises along the way. The second module, module 2, there's a group presentation in the middle of that module. That's the only group work that's involved. The rest of the assignments, you have kind of control over your timelines. The group presentation is really valuable, and I understand a lot of people don't like group work. Some people love it, but you do get to work with each other and get to know each other, and it's really important, especially for an online program, that you have that opportunity to kind of just get to know each other informally outside of your work with the lecturers and kind of the academic tutors along the way. And because you are all professionals coming into this course, you're bringing a wealth of information and like professional experience. So getting to learn from each other is one of the best things about this program, and it's one of the things that people give us feedback about kind of after they've completed the program. So and that presentation is on the content that you're covered in module 2. Just to give you a brief overview of the content, the general things across the 9 months that you will cover are positive psychology. So that's kind of some of the interventions and ways of working that work towards moving us from kind of a neutral, languishing, we're kind of at 0, to a more positive state of mind to take us towards thriving, and what we can do to activate those states of mind. Then we look at lifestyle medicine, which really looks at the combination of pulling in the mind and behavior and the physical body, and looking at what we can do to prevent disease, to reverse disease, and to treat disease with lifestyle changes as well. But a lot of it is on prevention. Then we will cover organisational scholarship and looking at positive organisations. And so that's really looking at applying positive health in your workplace or other people's workplaces. And then the other area that's really lovely and important to look at is motivation and behaviour change. So how can you pull all of that knowledge together to actually activate it and help move people and yourselves towards positive change? And there's a lot of theory and research around that that's really interesting. Within those modules, then we also touch on educational psychology and positive education, and what we can do within the education setting to promote positive organisations within a whole school approach, but then also looking at what kind of approaches to health and well-being would work in an educational context. And your modules then from 1 to 3 are scaffolded in that module 1 gives you an overview of those approaches. Module 2 then dives much deeper and would be the most challenging in terms of the physiology, medicine, biological content. And then module 3 really looks at applying the knowledge that you've gained from modules 1 and 2. And you get in module 3 to meet a lot of people who are working in the area, and they will give you an overview of how they've applied positive health and so give you kind of some ideas around how you can work in the real world with the content that you've been learning. I just want to say a little bit more about the assignments. I'm just going to take a glass of water. We've all gotten very good at looking after ourselves. and being hydrated, as you all probably know already, is part of the deal for positive health. But in the assignments, so module 2, which I've spoken about already, has a group assignment and then a small written piece at the end. And that written piece relates to the content in module 2. That's kind of a standalone assessment. Assignment number 1 and assignment number 3 are related, which is quite nice because you can build on the work you've done in the first assignment when you're doing your final assignment in module 3. And what you're asked to do in module 1 is to write your personal health plan, drawing on the academic content that has been covered in the first module. So you get to basically show off the knowledge you've gained in the module and also apply it to your life for your personal benefit. And it's just important to say that really that it's a big driver in terms of the design of this program. When we first looked at the syllabus and the academic content, we really wanted this program to be something that would contribute to your individual growth and positive health, not just to your academic and professional life. And from reviews with previous students, we've managed to achieve that, and we're quite proud of that. So it's important really to highlight that while all academic assignments are quite torturous and that there's, writing and scientific rigor involved, the assignments in module 1 and 3 are really lovely in that you get to apply them to your life and make positive changes. So in assignment 1, you write your personal health plan and you make goals and you set those for the rest of the 9 months. Then as you approach the end of the program for your assignment number 3, you basically write a revised health plan. You reflect on what happened over the course of the 9 months based on what you've learned in module 3 now. There's some new information. What would you have changed if you'd known this? What would you add to your health plan going forward? What worked? What didn't work? And I'm in the middle of grading the assignment 3 assignments at the moment, and they're always hugely inspiring, and you really see the benefit of the program for individual people. And each student has their own, kind of journey and different goals that they want to work on. And just for somebody who's in the area and kind of constantly trying to apply the principles, really looking at the students' work is very inspiring. And I think there's something very different when you're studying the content and you are being assessed. There's something around it that really focuses your mind. So those health plans seem to be very strong compared to, say, my health plan, which goes off track quite a lot, and I forget about it. So it's kind of 9 months to focus on you and really develop inwardly and in terms of your health and well-being, and then academically and professionally as well. The last thing to say about the syllabus and the academic content is that we're really looking at a whole person approach, and we want you, when you leave the program, to understand the connection between the mind and the body, and to really be able to look at the person holistically as both mind and body and spirit, whether that's like, kind of religion or spirituality or just transcendence. Maybe people like art and connecting with nature and all of those things. So beyond the self, and looking at the person within their context and their environment. So looking at the social aspects and the social determinants of health. So we really want you to have a whole person view of health and well-being. Okay, Miriam, I think we can go on. That's a lot of information. Okay, these are just some of our wonderful alumni, and you can read the quotes yourselves, so I kind of won't go into reading them. It's probably more interesting for me to give you just a sense of who they are as people, and give you a little bit of their personal, professional kind of story. So we have Ciara here, who came from dentistry and working in the HSE in orthodontics, and came on to our professional diploma. Really, Ciara's passion is really understanding that dentistry and good dental health is more than what you do in the room. It's really inspiring the person with the teeth to take ownership and to take agency and really understand the wider context and the wider importance of having good oral health. So that motivated Ciara to come into our program. And as she learned more, she became more motivated and excited. And Ciara actually is now doing a PhD with us. And she's looking at developing education programs for young people around oral health and dental hygiene, and really looking at kind of a person-centered approach and what's meaningful and what will make sense for young people in terms of motivation. And then Dominique came into us with a huge wealth of experience already. And I think what Dominique got from the program was really a confirmation of the work she was already doing. Dominique has worked as a food critic and as a chef, and she set up her own businesses within the food industry. She's also written a really fabulous book looking at, she was focusing on the keto diet, the ketogenic diet, because she had went through cancer treatment and was looking at kind of different options for nutrition around that. And she co-wrote that with another author who had gone through cancer treatment as well. And Dominique's gone on really to pull what she already knew together through doing the professional diploma. And she's currently running the cafe and nutrition centre at the VHI 360 clinic in Carrickmines, which really focuses on building nutrition into medical practice and looking at kind of personalised medicine and personalised nutrition plans for various medical conditions, which is really exciting. Ian's really interesting, and it's nice to highlight Ian because Ian actually joined us from Australia. And as you know, there's a big time difference, and he wasn't sure how it would work, but it worked out really well. He was actually our class rep for half of the year. And Ian comes from a pharmacy background and has been pulling on applying a lot of that into his pharmacy work. The thing to say about the working on different time zones, if any of you are on different time zones, it can work. The webinars are mostly recorded, and then we have live webinars. And because you're all busy professionals, there are times when not everybody can attend the live webinar. And the live webinars are recorded and you can catch up. So I think, you know, for me, as somebody who's always juggling stuff and, you know, childcare and different responsibilities, it's those kind of things that I don't want to ask about in the questions, but that you need to know about. And there is flexibility. And I think that's one of the good things around this program, is that it can work with a variety of different kind of personal demands. And I think that's really important for people to know. Okay, Mariam, I think we have another nice slide coming up. I just put this slide up because it's really helpful. We've conducted surveys and evaluations with our past students, and there's lots of positive things that have come out of the results of the survey. But I really love this one because essentially what the studying the professional diploma has given to our students is this sense of you were right all along. A lot of people come into us from either the health service or from the education sector or from various areas like coaching and different therapies, where either they're in a government service where they feel like things are not being done in the right way, that there's a better way, or they've left different services or industries and tried to do it on their own in a better way. And coming into the program and learning the content and getting the academic gold standard and the really rigorous research confirms for a lot of people that they are on the right track, and that they're going in the right direction. And what has happened with a lot of our students is they come into the program initially hoping to leave jobs or careers that they're deeply frustrated with because the system seems broken, essentially, or not working towards health. And they see the only option is leaving. But then from studying on the program, a lot of our students gain the kind of academic knowledge and the right words and the right references and kind of the confidence to go back into their organizations and to say, no, I want to work like this. This is actually the best way. This is the evidence. can we try this and let's do this together? And it has motivated a lot of people to be able to stay in their occupations and their careers, but to make changes from within them, which I think is it was eye-opening for us, and I think surprising for everybody who had started the diploma hoping to move on to something else. But I think that's important. And just to say that one of the things about the programme, which I guess is quite special, is that you get to work with people who are deeply passionate about really looking after people and themselves and finding a better way to achieve health and well-being that takes into account all of the person. And you find a home in that. So there's a values-driven approach in the programme that's quite just very reassuring, and you get a sense of home and place in that. That I think in other academics that aren't so tied into values that strongly, I guess, because they're academic, you don't necessarily get. So that's kind of a side benefit of you get to work with amazing people with really passionate purpose, who want to change things for the better. Okay, Miriam, thanks very much. I think, do we have one more? Just Q&A.
Yep. So we have one question that has just come in. So is the entire course online, or is there any on-site lectures, workshops?
That's a great question. So the programme and the content of the professional diploma is all online. But what tends to happen over the course of the year, because we have a number of different programmes running, we have opportunities for students to get together in RCSI for something like, if there's a public lecture going on, students will be invited and asked, kind of encouraged to come together for those things. And what has also happened previously, so the first thing is there's informal RCSI events or centre events that you all are encouraged to come to, and then we make a point of making that a networking space for you to meet us and to meet each other. But there's no pressure, you don't have to come to those. And so they happen throughout the year. Then what also happens is that depending on where people are located, there's been almost like regional groups of students who get together. So in one year, there was a number of students in Cork, and they would meet up in person in Cork. And people in the kind of surrounding counties would come there to meet, and then people in Dublin would meet up. And there's space for you to do that and to facilitate that amongst yourselves. And at times, there's been a dinner where maybe people have organised something in Dublin, and one or two of the lecturers have come to that. So there are opportunities for in-person get-togethers. The thing to say, and I'm saying this because I've had the question come in two sides from different students in the past. One is, we'd love more contact, can we have more? And then from other people who have huge personal demand saying, I did this program because it's online, I don't have the capacity to travel, please don't make me meet up. And so there is no pressure to attend any of the in-person gatherings. And we've deliberately constructed the program like that because we understand the value of meeting up. So we want those opportunities to be there, but we also understand that some people you're doing your best and you're just trying to fit this program into a lot of other responsibilities. And so there's no expectation that you have to attend those. Okay.
Thanks, Trudy. So we don't have any questions at the moment, but I'm sure that more will come in a while. Another thing to note on that, I suppose, is we do, like the survey answer you just saw, we do take on everyone's feedback throughout the course and then after during surveys and things. So I think this year, for the year 23 and 24, we're currently devising a plan for on-site and online webinars that are just kind of topics of interest related to positive health and things like that. Industry experts, people, we might get some of the people that are already teaching on our courses to do kind of topics of interest. For example, some of the feedback was for this particular course, because it's all online, that when they did go back into industry or wherever they were previously working, they missed being kind of having that networking system where they could speak about specific things that they spoke about on the course or challenges they faced with a group that would understand what or would be able to kind of give them advice for their challenges. So we developed, because they were in professional settings, we kind of devised a plan saying we'll set up a LinkedIn group. For some of you maybe already a part of it, to basically support everyone and share resources, give people updates on things. For instance, like Lifestyle Medicine Week, Men's Health Week, like we shared the resources that we'd be kind of linking in with. So if you wanted to do something in your own organisation, you'd have evidence-based resources that you could implement into your organization as well. And I suppose that's a really important thing for us, is that everything is evidence-based and backed. And then again, we use this kind of platform as a base for asking people what they want. So one really good comment came in through that LinkedIn page asking for careers advice, or like, can you give us more information on careers in this area or the future of careers in this area? So we're currently developing a panel that will consist of some of our staff, industry experts, and current alumni. And together they'll kind of devise a conversation, and I think that would be the best format. But there's things like that's stemmed literally just from that LinkedIn group, that we're going to kind of create events online and on site that are developed for you and what you need right now. Same with the resources. Porrick done on one of our he teaches on our masters. Does he teach on? He teaches on the professional diploma as well. Yeah, he teaches on the professional diploma as well. Dr. Porrick Dunn, he developed lifestyle medicine resources for Lifestyle Medicine Week and for the courses, and they're so beautiful and helpful, and you can look at them and understand them, but they also have QR codes leading back to all the places that they found that are evidence-based research as well. So it's really, really helpful kind of resources that we have on that page, and it's growing rapidly, and hopefully it'll be a really, really useful tool for you as well when you graduate. So I think the goal with this program is to be really, really helpful while you're here and to achieve your goals, whatever they may be, because everyone that comes onto the course will have different individual goals. That's another thing about the course in particular, is that it's not like when you leave you're going to be like X, Y, or Z. It's like you let, I suppose, the program directors and your module leads know what you want to get out of this course at the start. And then I suppose when you're actually implementing all your assignments, you'll be able to kind of do different things to kind of help achieve those goals, whether it be progressing on to the masters and things like that, or just finishing up and maybe doing something like Kira did, where she went and did a PhD straight after this. Or you could your goal could be changing jobs after this, and then you could finish the program and you decide that you don't want to change your job anymore, and that has happened as well. Trudy can give a little bit more feedback on that as well. But if you do have any other questions, you can pop them in the chat. But I suppose, Trudy, looking at kind of this area in particular, why is it so important now? Why is it a necessity over a kind of nice to have thing in organizations?
Yeah, it's a really good question. And I think it's this area is really, we're at the cutting edge, and we're lucky in that we're at the beginning of it in a way. And so starting on the professional diploma gives people an entry point into an area that's starting to expand. There's a few reasons why it's really important. All of the health services are moving towards looking at prevention rather than treatment. And that's simply because of the growing numbers of people in the world and the escalating costs of healthcare. It's not sustainable. So looking at kind of bringing people into hospital, keeping them in hospital for medical treatment is not sustainable any longer. So there's a push, which is both, largely economic, but then, outside of the economic push, there's obviously a lot of philosophical and human reasons why it's a better way to live. But as we know, cynically, most of these things only happen when there's a good economic reason for them. But we've reached the point where the economic arguments are so strong now that we have to move to a preventative model of looking after people. And some of the issues and focuses in that are looking at enabling people to look after themselves at home and empowering people to be able to help themselves. So a lot of the lifestyle medicine work is really around educating people and offering supports and getting in there before there's any disease progression. So just for anybody who doesn't know lifestyle medicine very well, there's 6 pillars that they focus on, and I just wrote them down because I always forget one of them. But it's exercise, which is basically physical movement. So moving, sleep, nutrition, eating well, stress resilience. So how do we tolerate stress and deal with it and bounce back from it? Avoidance of risky substances. So not overindulging in any, alcohol or drugs or any of the risky substances. And then developing strong relationships, because they're really important for your health and well-being. So, within the HSE and the NHS, and even in the States at the moment, there's new models of care which are really looking at working with people at home in the community. And, people will be aware of social prescribing and kind of initiatives like that coming in. Just this week, I think there was something around James's, and they're calling it inclusive health, I think. But they're looking at kind of a wraparound model for people who are in homelessness, but addressing all of their needs rather than just bringing them into hospital, treating the specific disease and then sending them back out and then they get sicker. And that's been expanded and piloted into 5 counties in Ireland. So more and more, we are being pushed into looking at people, what an individual can do to prevent disease, and then what we can do within society and within the community to support people. That's within the healthcare field. And because that's coming through finally in the healthcare field, economically it's coming through in insurance companies, and anybody who has health insurance will see, they're all offering these health checks, access to nutritionists, physios, and this is the reason why those things are there. Most of the health insurance companies have health coaches, which are employed now to coach you through that. And that's one of the kind of career options for somebody doing this program. But what's also happening, it's becoming culturally available. So it's becoming the normal way of talking now. So within organizations and kind of HR and organizational well-being, this is the way that organizations approach employee well-being. Within the education setting, this is the way that the Department of Health are starting to focus on looking at student and teacher health and well-being. So, and I know it's difficult for teachers because they just get more and more jobs added to them, but well-being is coming in more and more into the curriculum and way of thinking about education. So in a way, it's going to be our mainstream way of thinking about human health and well-being. And we're moving away from the kind of internal organ and a disease for each organ. The last thing to say is that the reason why that is really is partly because of the growing numbers of people and cost of healthcare, but also as we've become more industrialized and we're living, we have more money to live and buy things, and we've become more consumeristic, I suppose. But what that has meant is an increase in diseases of lifestyle. So the biggest things that are causing disease and death within Europe are things that they're classified as chronic lifestyle diseases, and they are non-communicable diseases. Essentially, they're diseases that we can impact on in terms of how we live in our health behaviours. So things like diabetes, heart conditions, some cancers, they're looking at links between behavioural aspects around that, mental health issues, and they have a huge burden on the health service and, kind of cost. So there's huge just driving forces in terms of how our health is changing and how we need to address our health and well-being. Yeah, I think they're the big things, Miriam. I don't know if that makes sense.
Thanks so much, Trudy. We just got another question. If I'm self-employed, will I have difficulty doing the assignments?
That's a great question, and I actually meant to address it. So thank you so much for bringing it up. No, you won't at all. A lot of our students have been self-employed, and some haven't been employed at all at the time of doing the program. And you don't need to apply it to a specific workplace. What you can do, there's a part of your health plan where you're asked to think about your work situation or your professional situation, and how that might impact on your health and well-being and your plan. So for some people, especially self-employed, some of the things that have come up in the past are, on reflection in module 3, now I'm looking at my health plan, my goals were really unrealistic because I'm self-employed and I have to work every hour of the day and I don't get enough sleep, and I didn't manage to get enough sleep, and maybe I should have focused on something else, or put in, or maybe now that I've finished the program, I can focus on sleep. So it's really reflecting on your context and how that's impacting on your health. And you can do that whatever setting you're in. And if you're not working, you can say, I'm not working at the moment, and it might be I've had the space to do my health or behavior changes, or it might be I'm actually quite stressed because I'm not working and I'm not seeing anybody during the day, and that impacted on my health plan. There was something else I was thinking of saying around that. I think that's the main thing, but really just to emphasize, oh yes, some people may not want to talk about their health and their workplace. So for example, if you're working in the HSE and you don't want to disclose, something that's going on, or you feel you don't want to break confidentiality, you can talk about hypothetical workplaces. It doesn't have to be true. It's really that you can apply the academic content to a situation, and that's really just for your safety, because you have control over what you disclose around that. Okay.
Thanks, Trudy. So we just got another comment saying sounds great, looking forward to starting. Another one that's a really good one. I'm a teacher and did 3 courses. They were so helpful, so thanks for that. Would this course be relevant to me?
Yeah, definitely. I think some people who don't come from a healthcare background, and I count myself in that because I'm coming from psychology, the module 2 where you focus on the physiology, that is the hardest module, just because we don't know the words for some of the pieces of the body or some of the mechanisms. But at the same time, there's other words that people who are perhaps coming from a medical background don't understand so well in other aspects of it. So for understanding people and motivation and some of the development and emotional stuff, somebody from an educational background will understand that, and you'll be able to get through those readings quicker. It's very relevant in that more and more this way of thinking and working is coming into the education setting. Dr. Yolanta Burke, and if you're in education, it's really, really worth looking up Yolanta. Sorry, I just have an image there, but I don't know if you can see the chat. But it's really worth looking up Yolanta's work. She has a book on whole school well-being, and Yolanta is an educational psychologist, and that's her passion. She works, her research is in other areas as well. She looks at the impact of environment and looking after the environment and our well-being, but her core background is education, and you get to learn from Yolanta, and she's a prolific researcher, very well respected, and really highly regarded in the field of education. So it's definitely relevant, and you will definitely learn stuff that's really important and also really motivating. And you get to link in with experts in the field. The thing to say, just while I have a chance, Miriam, is that because I'm not sure why, I was going to say because the program is relatively new and we're all bananas in terms of how passionate we are about this field, the program, we're all very approachable, and we're delighted to talk to you all and link in with you, or if you have an idea or you want to talk more about something, so that's there, and it's just a lovely culture and atmosphere in the program. So for anybody in education, Yolanta would be the person that you would link in with. And just to say that as well about the online thing, we have a forum online where you talk to each other and talk to us and throw up questions throughout the module. And I was looking at this and I found this reading, and there's a lot of back and forth and sharing of information, and it just feels very safe and generative, that kind of it's like a little village square almost, where people can talk and share ideas. So yeah, I just put up an image there as well, just to say that the program is an NQF level 9, which is really nice, in that it is at the same level as, so a master's is level 9, And so it's nice to have an NQF level 9, I suppose, is what I would say about that. And it's considered that because it's an overview of a very particular field, and the idea is that it's to give you a bunch of knowledge. You'll see there on the 9 on the image. So there's masters, and then there's postgraduate diplomas. So that's where we fit in there, which is quite nice to have that that scope within your CV as well, just to be able to say that.
Yeah, no, definitely is. And I suppose that is, like, we were even speaking about it beforehand, Trudy, about questions and how, like, even coming on a new team, we love questions because it highlights areas that the team mightn't have necessarily just brushed over before and thought were obvious. So I think that's the same when it comes to this area. It's so new that, like, when we got questions from people who are working in different industries, it's just so enlightening. It's so exciting. We love them. So if there is any questions on the course or content or research that you found, like, do share it. And that doesn't stop at when you're doing the course. That's like why we've created the LinkedIn group as well, and we do the surveys and different things like that. And like all on our social media, like our alumni and current students are so incredibly active. It's really, really nice. And it's really nice to have done the course and have that confidence to be able to say, like, oh, I'm right. Like I am right when I speak about this, because it's evidence based and I can prove this because of this research, or I've done and found, like, looked at different studies and you can see clearly that this is the answer right now, and that them answers may change over time, even by some of our researchers. But it's really, really exciting area to be in at the moment. So do ask questions, ask as many questions as you want, because that's the world we're living in now, that it's an open space for everyone to kind of be sharing information right now. And I suppose that's another problem with the world today, is that there is so much information out there, but that's more of a reason to ask more questions. But I think I have another few questions coming in there now for you, Trudy. I suppose basically the typical question that comes up on any postgrad course is, how am I going to do this? How much time do I need to set aside? I have like kids, a full-time job, I have a social life, I have friends I want to meet up, and family. How am I going to do it all? What's the availability should I set aside each week to study?
It's a great question. I'm just looking at our syllabus here and looking at the kind of the breakdown of, how many hours should you spend on each module. And I'm gonna just share this in the chat here, and just to say that this is provisional. So it's kind of like asking how long is a piece of string. So let me see if I can share that in the chat. Just, this is an average and an estimated kind of number. So don't take those as hardcore numbers, but it's, so each lecture, and we've broken down the amount of hours. Okay, so the live webinars are around 20 to 21 hours for each module. Then you might do something like a case presentation if you were doing group work. Preparing for your coursework might be 20 hours. Independent learning time might be up to 153, but that varies. Assignment preparation might be 33. Writing up your personal health plan and developing that might be 20. So then that's broken into 250 hours. What I would say about this is that it's almost impossible to estimate how much each person needs to spend, because depending on your professional background, you will need to spend more or less time reading the content that is your backup for the lectures. And each module, one of the modules will be your strength, the other module will be more challenging for you, and you'll need to spend more time on that. The other thing, some of us read faster than others, some of us take in auditory information. What I would say is be realistic in terms of being able to do things, but also understand that it's cumulative. So what I find, and what a lot of our students find, is that if you're coming back to education, module 1 can feel harder and slower just because you're learning how to learn again, and you're kind of just getting into the groove of kind of timetabling and juggling and all of those things. And then by module 2 and 3, you've worked out a system that works for you. So it might be you're going to watch the live webinars while you're doing something else, or you listen to them a few times while you're driving. You know, there's different things that people do to help get the content in while also working through their normal lives. The last thing to say is the content tends to stick and be easier to metabolize because it's interesting, it's relevant, it's applied to your life, and it tends to be applicable to your work as well. So compared to other courses, these hourly guidelines are kind of standard guidelines for academic courses in general. But when you're doing something that is very relevant and that you're very passionate about, you tend to be able to do it faster. And you kind of take in the information faster as well. So I don't know if that helps, or if you have anything else to add from your experience, Miriam, of seeing students go through different things.
Yeah, I suppose just like being able, basically on our courses, you'll have your program director who deals with all the academic side of things. You'll have a program coordinator, which is myself or Suzanne, who will be dealing with kind of all the kind of other stuff, so operations kind of things for the course. So if you do feel like, we always say this, but like I've been there on courses, like I have been there, and it's like a couple of weeks to go when you're meant to have everything done already and prep work done. It's nearly like the minute you start feeling that is when you should start reaching out and saying, like, what should I be doing better to just be able to catch up at this moment in time? Life got in the way. Like, it's so, like, we're here to help. We're not meant to be the bad guys that give you like a fails. So I think that's really important. Like, if you don't succeed, we don't succeed. So like, if we get more people to succeed and achieve their goals, then that's how we succeed. So like, I think this is kind of a team effort on like having that, like, we're just being able to stop, reflect, and just say, how am I getting on right now? And whether that's like every second week, every week, just have a little check-in with yourself, because reflections can be so beneficial for when you're doing these courses. And like, I know from all the courses that I've done that I'm like, oh, it nearly turns into this, it just stays growing into this monster that you're like, oh no, I can't do it and I'm so busy, and well, I'll just leave it for another week and I'll book a whole week off work and I'll be able to do it then. And then you realize like, oh my God, this is atrocious. What am I doing to myself? So like, if you just do a little bit at a time, like Trudy was saying, you'll have then 250 hours built up in no time. Because I think when people say 250 hours per module, that's the scariest thing I've ever seen in my life. I can barely get like 5 minutes away from for a cup of tea, let alone 250 hours for a course, especially these days. But that's literally everything. So you will have, some people have more experience in specific modules or areas or skill sets than other people on the course. So it is really important to just keep that in mind, that you will be able to kind of, as you progress as well, that you'll be able to kind of increase the speed of those skill sets. There is a good few questions that I can just fly through here at the moment that I'll go through. So closing day for applications, it's the end of this month. We like to have most of our applications in by the 31st of July, just because you are starting and we want to get your IT credentials, we want to get you set up on the virtual learning environments, and get you all set for orientation, and just kind of have a relaxed environment going in there. So if you are thinking of doing the course, do get your application started ASAP, because they do take a little bit of time by the time you get your transcripts sorted, like all the application filled out, all that jazz. And again, we're on the email for any of your questions or concerns. If you can't find transcripts, anything, there's always a way around it, so don't worry about it. We've covered all those ones. Oh yeah, I'll get back to the question about can the course be applied to a more corporate setting rather than healthcare? So I'll come back to you on that, Trudy. I just want to get a few of the rest of them done. Oh yeah, so can you do the diploma course if you haven't got a degree already? Yes, we do recognition of prior learning, and that comes in the form of exemption of modules and in so if you don't have a level 7 or 8 degree. So say you were a nurse that did it years ago and that there just wasn't that degree at the time, that's no problem. You can apply through recognition of prior learning. And that is all instructed. Like my advice before you go down that route is get your application in and we'll tell you instead of like, because you might necessarily need to do it. But if you get your application in, submit all the documents that you do have, and then we can say, okay, you're missing X, Y, and Z. Do you have them? And then if yes or no, we can progress straight on with the application, or we can do recognition of prior learning, which is it comes in the form of an essay style. But we'll be able to give you all the details on that. And it's not something to be afraid of either. We're here to help on that as well. So yeah, there's one more question in there. Oh, how many on average on the course? So Trudy, do you want to go on to those two questions? So on average, how many are on in a class size, I suppose? And then can this be applied, can any of the teachings, I suppose, be applied to other industries other than healthcare?
Yeah, great questions. Yeah, it varies from year to year. Obviously, in our very first year, we had a smaller number of students, but on average, we have about 50 students in the program. And it works well. Not everybody can attend the live webinars, so we usually have about 25 or 30 people in the live sessions, and that gives space for people who want to contribute and hop on and have a chat. And there's enough variety within the group. So that's around the numbers. There's definitely very much a relevance for the corporate sector. A good portion of the content looks at positive organisational scholarship, which is really around workplaces, organisations, the corporate sector, how to make workplaces and corporate settings safer, healthier, more effective, better places to work. And we have, like, just to say, we've loads of really relevant experts. Ryan Nemiak, who's from the States, and he's the director of the VIA Character Strengths Institute. But strengths work, which we teach a lot on the program, is really relevant to organisations and corporate, because when people are working from their strengths and using a growth mindset and all of that stuff, then the culture and the setting and the individual in that corporate culture is happier and kind of more productive in their work as well. Yeah.
Thanks, Trudy. I think we covered most of the questions in there. That was really, really helpful. We always think we have covered all of the questions until we go on to the next webinar, and then we have loads of new questions. So thank you all for those. They're really, really helpful on this journey, I suppose. And like, I know these are really, like, you might have finished up with this webinar saying, okay, I'm definitely going to do this course, or I'm definitely not going to do this course. This is not for me. But I think for us, a really nice way to stay in touch, and kind of, if this is something that you're interested in, is to follow all our social media accounts as well, and keep on our mailing list, because we will have upcoming events. We share our most up-to-date research all the time on our social platforms. Maybe now is not the right time for you, but like maybe the future is. So if you keep on our lists, we'll invite you to all of those amazing webinars. We just have one more question in there. Is there dates, time schedule yet for the live dates on the course? Yes, there is. So if you go onto the course page, what I will do is I'll share my screen. And this is the course page. So this is our lovely course page for the Professional Diploma. I will share my screen, that might help. So you land here first, and you have like why RCSI, our program information webinar, and then you go into course details. This is where you'll find all the nitty-gritty stuff. So why study of those, learning outcomes of the modules, you'll have all that. And then you have our module descriptors, and that they are 10 credits each. And then you have our timetable. So these are the kind of blocks that they come in. And when you download this document, it'll have the blocks, and it'll also have all your details on the different live webinar, the provisional webinar dates. So they're most likely going to stay the same, but we'll have them all definitely confirmed for orientation, but they're most likely not going to change from these. So we do kind of orientation where you'll kind of meet the teams and stuff like that, and you'll have coffee mornings and stuff like that. And then it goes straight into the different webinars, and these will be all recorded. So if you can attend, please do try and attend, but just to be part of the conversation, because it's so beneficial and the group work is amazing. But if you can't, they're all pre-recorded. So that's all available there. I'll quickly run through this in case you haven't seen it before. And then entry requirements. You have the basic details on the entry requirements and gives you some details on recognition or prior learning. I wouldn't jump into this until you've done an application. Applications are completely free, so do your application, submit all your documents, and then we'll advise you on recognition of prior learning. And then fees and funding. We do a payment plan. So on acceptance of your offer, to accept your offer, you submit proof of payment for the 2,000, then it's again in November and then again in March. We don't have a difference between EU and non-EU fees for the professional diploma. It's because it's a fully online program. So the fees are the same for international students as well. And then here are some of our details, and we have a sponsorship form if you are sponsored. It just gives you an outline of what to be looking for if you're getting sponsorship forms. But sometimes we get letters from the organisation as well. Like, so if you're coming from the HSE, normally they send them straight to our fees department because we get a lot of them. And then how to apply. So you land on this, you press on the apply tab, and it brings you to the application page here. You'll see the deadline is 31st of July. It's kind of a soft deadline, but we try and get everyone sorted. We want to get everyone in for orientation. So these are some of the documents you may need. But if you have any questions, you can just drop us an email. So that covers a lot on the course pages and stuff like that. But yeah, and you'll find all your dates and times and everything in the course details section. Fly down, timetable is all there. Again, if you have any questions about that, give us a shout. So yeah, so some of the questions come in were just about schedules and stuff. So if you don't have any other questions, then I think I'll finish up. On our final, I love finishing it, a final note with just, I suppose, looking at the future of positive health sciences and just this whole area, whether it be in healthcare, corporate, education, just in general. Trudy, what excites you about this whole area looking into the future?
I guess that we have a chance to genuinely make the world better. And that's amazing. Like, it's not fluffy. There's science and research to support that we can make individual lives better, but that in order to do that, we have to change how we live, how we work, how we teach. And so we will impact on the world and our society by changing individual health. And that's phenomenal. So that's, yeah, I know it sounds massive, but it's the fact that that's actually a real thing that we can do is what blows me away.
Thanks so much, Trudy. As always, it's been an amazing webinar, and thank you so much to everyone who has joined us today or who's looking back on the recording. I know there's hundreds of you that have signed up to our webinars there recently. There's a lot of interest in this area, and I'm sure it's just going to stay growing and growing. It's infectious. So thank you so much, Trudy, for joining us today. Again, we do have, if you are interested in this course, our masters or anything else, please let us know. We do have a recording from our master's webinar where we invited our three program directors for that to have a chat with you similar to this. So if you have any interest in seeing that, just give us a shout as well. But for now, thank you so much for joining us, and we'll see you in the next one. Thanks everyone.
Thanks everyone.